So guys, we're going to discuss certain basic points in the general anatomy. See, we get question only from these topics only. So we limit our discussion less than 1 hour. So we see the types of bones, and then we see the types of epiphysis, and then we discuss the types of joints. From there only we are getting questions. And finally we discuss about the muscle architecture, muscle classification based on their shape. Right. So to begin with, we're going to start with the types of bones. Now, types of bones. Now, first, long bones, short bones, flat bones, irregular bones, sesamoid bones, and we also have one more bone, pneumatic bones. One more bone, pneumatic bones. Now, long bones, they have two ends, the epiphysis and the diaphysis. So long bone means they have epiphysis and they have diaphysis. Now see here. Now this is the feature of the long bone. They have epiphysis. Epiphysis are at the end, and we have a shaft that is called diaphysis. Now we also have metaphysis. Metaphysis is nothing but it is the epiphyseal end of diaphysis. It is the epiphyseal end of diaphysis. So long bone means they have epiphysis, diaphysis. Now long bones are, yes, the femur long bone, femur long bone, humerus long bone, radius long bone, ulna long bone, tibia long bone, fibula long bone. Now we have one more bone called clavicle. That is also long bone, but it is the modified long bone. Clavicle, it is the modified long bone. Now why it is modified long bone? Clavicle, it is not vertically placed. See, almost all these bones they are vertically placed in the upper limb and the lower limb. But the clavicle, which is not placed vertically, it is horizontally placed long bones, which is horizontally placed. First point. Now in all the long bones, see here, you are seeing the medullary cavity. But in the case of clavicle, no medullary cavity. So long bone have medullary cavity, but clavicle, no medullary cavity. The long bones, they ossify by means of cartilage. Whereas clavicle, it is ossify by means of membrane. And the clavicle, which is placed just below the skin, which is subcutaneous. This is a property of the clavicle. So clavicle, it is a modified long bone. Okay? Right. So long bones over. Next, short bones. Now the short bones, they are named according to their shape. Short bones are named according to their shape. According to their shape. Carpal bones, short bones. Tarsal bones, short bones. Now carpal bones we have trapezium, trapezoid. So they are named according to their shape. Okay. Similarly, tarsal bones. So carpal bones and tarsal bones, yes. Cuboid bone, tarsal bone, yes. They are named according to their shape. Next, the flat bones. Now these flat bones are protective in function. Okay. So flat bones, below you can write, flat bones are protective in function. Now bones of thoracic cage and the cranial cavity, the cranial vault. So bones of thoracic cage and the cranial vault, see the cranial vault and the bones of thoracic cage, they are flat bones. Next, irregular bones. So name itself you have a clue, they don't have a regular shape. Example, the vertebra and hip bones. They are the irregular bones. Right. Now next, sesamoid bones. Sesamoid bone means bones formed in tendons. Bones formed in tendons. The largest sesamoid bone is our patella. that is formed in the tendon of our quadriceps femoris muscle. That is formed in the tendon of quadriceps femoris muscle. And we also have pisiform bone. So pisiform bone, which is formed in the tendon of flexor carpi ulnaris. Now we also have another sesamoid bone that is found in the lateral head of gastrocnemius, and that is our fibula bone. Fibula, which is formed in the tendon of lateral head of gastrocnemius. Lateral head of gastrocnemius. So these are the sesamoid bone. Sesamoid bone means bones formed in tendons. Okay, right. Now we also have pneumatic bones. See, pneumatic bones, yes, the name itself you have a clue. Pneumatic bones, the name itself you have a clue. They have air-filled cavities. So what are the bones contained in the air cavities? Number 1, frontal bone. Number 2, sphenoid bone. Number 3, ethmoid bone. Number 4, maxilla bone. Mastoid bone. Mastoids are part of temporal bone. So all these bones, they contain the air cavities. Okay, right. Now these are the various examples for the different types of bones. Just to know the type and their example. That is more than sufficient. Now next, we're going to discuss the epiphysis. Okay. Now epiphysis, it is the end of the bones, long bones. So we have various types of epiphysis. Now what are the types of epiphysis? Number 1, our pressure epiphysis. Number 2, traction epiphysis. Number 3, atavastic epiphysis. Atavastic epiphysis. And number 4, aberrant epiphysis. Now see one by one. Now what is pressure epiphysis? See, pressure epiphysis, they takes part in the joint formation. So pressure epiphysis, they take part in the joint formation. They take part in the joint formation and they transmit weight. And they transmit weight. Now what are the examples for pressure epiphysis? Pressure epiphysis, yes, it is the head of the humerus bone, head of the femur, head of the humerus, head of the femur are the examples for the pressure epiphysis. So they take part in the joint formation. The head of the humerus articulate with the glenoid cavity to form shoulder joint. The head of the femur articulate with the acetabulum cavity to form the hip joint. Right. Now next one, traction epiphysis. Now traction epiphysis, they are not involved in the joint formation. They are not involved in joint formation. Now they are formed due to the pull of the muscles. So they are formed due to the pull of the muscles. They are formed due to the pull of the muscles. Okay, right. Now what are the examples for the traction epiphysis? Now example for traction epiphysis is the lesser tubercle, greater tubercle, lesser tubercle, greater tubercle, lesser trochanter, greater trochanter. So everything. So these are formed due to attachment of muscles. Now lesser tubercle, which muscle is attached? Very good. Subscapularis muscle is attached. Similarly, lesser trochanter. Very good. Iliopsoas muscle. Just remember certain, yes, attachment on these bony parts. Now traction epiphysis, yes, they are not involved in the joint formation. They are formed due to the pull of the muscles. The traction epiphysis. Clear? Now next, atavastic epiphysis. Now atavastic epiphysis, phylogenetically, they are the independent bones, but they fuse to the nearby bones only for nutrition. So atavastic epiphysis, these are phylogenetically independent bones. Phylogenetically, they are independent bones. Phylogenetically, they are independent bones, but they fuse to the nearby bones for their nutrition. Fuse to the nearby bones for nutrition. Example, coracoid process. Example, coracoid process. Okay, right. Now next one, last one, aberrant epiphysis. Now aberrant epiphysis, it is not usually present, which is not usually present. Okay. Examples for aberrant epiphysis are the head of the metacarpal bone, and base of the head of the first metacarpal bone and the base of the remaining metacarpal bone. Okay. Now the epiphysis, yes, which is usually present in the base of the first metacarpal bone. The head of the first metacarpal bone does not have epiphysis. In some cadavers, we may see the epiphysis at the head of the first metacarpal bone. Okay. So they are unusually present. They are not usually present. There are some variations. So in some subjects, we may see the epiphysis at the head of the first metacarpal bone. Is that clear? Any doubt? Now these are the various type of epiphysis you have to remember. Okay? Right. So now next one, we're going to discuss the types of joints. See, types of joint, I think you know the meaning. Joint is nothing but it is a meeting point of two or more bones. Right. Now the joints are classified into synovial joint, fibrous joint and the cartilage joint. Now first we're going to start the discussion about the synovial joints. So what is synovial joints? See, synovial joints are nothing but, see, this is one bone and this is another bone. Now the bones are covered by the capsule. The ends of the bone are covered by capsule. Now inside the capsule, what we see here, the synovial membrane is present. The synovial membrane is present inside the capsule. Now what the synovial membrane will do, sir? The synovial membrane which secrete synovial fluid. So inside the capsule, synovial membrane is present and the synovial membrane secrete synovial fluid. Now this is the basic of all synovial joints. In the exams, yes, you never get any question about this. They will ask you only the example. All the following are the pivot type of synovial except which of the following is ball and socket. The calcaneocuboid joint is example for which of the following. Likewise, they will ask you only the examples. For the completion sake, I am saying this. Okay. So synovial joint means the fibrous capsule is present inside synovial membrane and the synovial membrane secretes synovial fluid. Clear? Now we're going to see the various subdivisions of the synovial joint. Number 1, the plain type of synovial joint. And then the hinge type of synovial joint. And then pivot type of synovial. First we discuss this. Plain type of synovial, hinge type of synovial and the pivot type. So please write by the side. Now the plain type of synovial, the name itself you have a clue, the articulating ends of the bone are flat. So the two ends of the bone are flat. So we have flat end of the bones. Now what type of movement will occur? The two ends of the bone are flat like this. So what type of movement will occur? The two bones will glide each other. Very good. So in plain type of synovial, mainly gliding movement will occur. Mainly the gliding movement will occur. That is important. Now what are the areas you see the plain type of synovial? Very, very important. Plain type of synovial, number 1, our intercarpal joints. Number 2, intertarsal joints. And then acromioclavicular joint. Very good. Acromioclavicular joint. Sternocostal joints. Sternocostal joints. And then our interchondral joints. Interchondral joints. Costovertebral joint. Costotransverse joint. So all these are plain type of synovial only. Acromioclavicular joint, yes. Sternocostal joints, intercostal joint, costovertebral, costotransverse. I think, yes, we discussed already in the thorax module. That's all about the plain type of synovial. Now next one, our hinge type. Now hinge type, the movement will be in one axis. The movement will be in antero-posterior axis, like a door hinge. So what type of movement will occur? Only flexion extension movement will occur in the hinge joint. Now what are the areas? You see the hinge joint. Elbow joint is a hinge joint. Ankle joint is a hinge joint. Interphalangeal joint is a hinge joint. Interphalangeal joint is a hinge joint. Elbow joint, ankle joint and the interphalangeal joint. Please remember, knee joint is not a hinge joint. See, hinge joint means the movement, only flexion extension movement will occur. But in knee joint, apart from flexion extension, the locking and unlocking of knee joint will occur. That is, internal rotation and the external rotation will occur. That is why knee joint, it is not a hinge joint, that is the modified hinge joint. Okay? Right. Now next, pivot joint. Now pivot joint, the rotational movement will occur. Rotational movement will occur, pivot joint. Mnemonic is Parvati, short form, Paru. So Parvati, Paru is a short form, no? Short form of Parvati, Paru. Right. Now P pivot joint, AA, that is the atlanto-axial joint. RU, radio-ulnar joint. Radio-ulnar joint. Please write radio-ulnar joint la superior and inferior radio-ulnar joint. So atlanto-axial joint and the radio-ulnar joint, the example for pivot. Now what type of movement will occur in the atlanto-axial joint? Now in the atlanto-axial joint, what movement will occur? No movement will occur. What is no movement? No movement means turning the head left to right. This is a no movement. 2018 AIMS question. So no movement is turning the head left to right and the vice versa. That is atlanto-axial joint. Clear? Any doubt? No doubt. So now this pivot, okay, hinge joint and the plain type of synovial, these three joints are uniaxial joint. Okay? Shall we proceed? Now 2020 exam, they gave this question in the AIMS exam. Middle radio-ulnar joint is example for. I told you the superior and inferior radio-ulnar joint are pivot. The middle radio-ulnar joint. Middle radio-ulnar joint. Middle radio-ulnar joint is example for fibrous joint. Again we see later, don't worry. So meanwhile, please put one note and then highlight here. Highlight the middle radio-ulnar joint. So middle radio-ulnar joint, it is not, yes, the pivot joint. It is the fibrous joint. 2020 AIMS exam question. Right. So now we completed the uniaxial synovial joints. Now next we are going to see the biaxial synovial joint. What are those? Our condylar joint, saddle joint and the ellipsoid joint. So our condylar, ellipsoid and saddle type of synovial. So condylar joint are, they have a condyles in their head. They have a condyles in their head. Now what are the examples for condylar joint? Our knee joint is a condylar joint. Knee joint is a modified hinge joint or condylar joint. Both are same only. But knee joint, it is not a hinge joint. Knee joint is a modified hinge joint or condylar. And one more joint is temporomandibular joint. Temporomandibular joint. Next, the ellipsoid joint. So ellipsoid joint, again they have a condyles present. But these condyles are in the shape of ellipsoid. That is why we kept as a separate category ellipsoid joint. Okay. Now the examples for the ellipsoid joint are, we have a mnemonic, wicket is going at once. The first ball itself, the batsman is giving his wicket. Wicket at once. WKAO. wicket at once. The first ball he is giving his wicket. So W is the wrist joint, K knuckle joint, AO atlanto-occipital joint. Atlanto-occipital joint. So wrist joint, knuckle joint and the atlanto-occipital joint. So these three joints are our ellipsoid type. Wicket is giving on the first ball. Batsman giving his wicket in the first ball itself. Wicket at once. Okay, wrist joint, knuckle joint and the atlanto-occipital joint. Now atlanto-occipital joint, what movement will occur? S movement will occur. The nodding of the head. S movement. S movement, nodding of the head will occur. S movement. Now next one. Now saddle type of synovial, the ends of the bone are, they are reciprocally convexo-concave. One end will be convex, other end will be concave. One end will be concave, other end will be convex. So they are reciprocally convexo-concave. Reciprocally, they are convexo-concave. What are the examples you will see here? Sternoclavicular joint. Sternoclavicular joint, it is a saddle type of synovial. And then calcaneocuboid joint. Sternoclavicular joint, calcaneocuboid joint, and the third one, the joint between malleus and incus. The ossicles. The malleus and incus, no? Yes. Now these three joints, you have to remember the saddle type of synovial. Sternoclavicular joint, calcaneocuboid joint, the joint between malleus and incus, and first carpo-metacarpal joint. Sorry, I forgot to mention here. First carpo-metacarpal joint. Now these joints are saddle type of synovial. Sternoclavicular joint, calcaneocuboid joint, the joint between malleus and incus, and first carpo-metacarpal joint. One last type of synovial is our ball and socket. So ball and socket, name itself we have a clue. So one end of the bone will be forming the ball and the ball will be fitting into the socket. Ball and socket joint. Now ball and socket joint are multi-axial joints. They are multi-axial joint. What are the examples? Shoulder joint is example for ball and socket. Hip joint, example for ball and socket. The joint between incus and stapes. Joint between incus and stapes. And next one, the talocalcaneo-navicular joint. Talocalcaneo-navicular joint. So shoulder joint, hip joint, a joint between incus and stapes, and the joint between the talus, calcaneum and navicular. See, everybody knows shoulder joint and hip joint are ball and socket. In the exams, yes, they never give shoulder joint and hip joint. Okay, everybody knows. The first year MBBS kid know this. They will ask you only about the joint about the incus and stapes and the talocalcaneo-navicular joint. So talocalcaneo-navicular joint, it is the ball and socket joint. That is a question they gave you in 2018 AIMS exam and also they gave in the FMG exam. Okay, talocalcaneo-navicular, example for ball and socket. Clear? Now these are the various types of synovial joint you have to remember. Now that's all about the synovial joint. Now we're going to discuss about the fibrous joint. Now the fibrous joint, again the name itself you have a clue. The bones are held together by means of the fibrous tissue. So bones are held together. Bones are held together by means of the fibrous tissue. That is a fibrous joint. Now what are the areas you see the fibrous joint? Now what are the subtypes of fibrous joint? Number one, sutures, and then syndesmosis and gomphosis. Now where you see the sutures? Sutures are seen in skull. What are the various types of suture? Now some examples we have to know for the exam point of view. The serrate suture, that is our sagittal suture. And then squamous suture, that is between the temporal bone and the parietal bone. The denticulate suture is our lambdoid suture. And last one, shin lysis suture. Synolysis suture, it is the suture you have to remember for the exam point of view. See, these three and all for the completion sake I am saying. So no need to remember all those. Just read once and then forget. No problem. But in the exams, yes, they will ask this only. It is the question you will get. It is a special type of suture present between the sphenoidal rostrum and the vomer bone. So Synolysis suture, it is a suture between the sphenoidal rostrum and the vomer bone. Okay, so these are the various types of sutures we have. Again, I am saying you don't need to remember these sutures. Please remember at least this Synolysis suture, that is more than sufficient. Okay. Now, next one, our syndesmosis type, suture over syndesmosis. So syndesmosis means the bones are held together by means of ligaments, a type of fibrous tissue. So bones are connected by means of ligaments. So we have two. What are those? Our middle radioulnar joint. So we have two examples for the syndesmosis type. Number one, middle radioulnar joint. The radius and ulna bone, middle part, they are connected by means of interosseous membrane. Middle radioulnar joint and inferior tibiofibular joint. Okay, so our syndesmosis joint are middle radioulnar and inferior tibiofibular joint. Okay, now next one, gomphosis. Gomphosis is tooth in the socket. Tooth in the socket, that is a gomphosis joint. Okay, so middle radioulnar joint and inferior tibiofibular joint are the example for syndesmosis. Okay, right, over. Now next one, cartilage joint. So cartilage joint, again bones are connected by means of the cartilage. Again cartilage we have three types, hyaline cartilage, elastic cartilage and the white fibrous cartilage. Now if the two bones are connected by means of the hyaline cartilage, then that is called as our primary cartilage joint. If two bones are connected by means of fibrous cartilage, then that is the secondary cartilage joint. Very simple. So secondary cartilage joint, otherwise known as symphysis joint. So symphysis joint, the fibrous cartilage is present between the two bones. The fibrous cartilage present between the bones, that is the symphysis joint. Now what about the primary cartilage joint? Primary cartilage joint, otherwise known as synchondrosis type. Synchondrosis type. Now what cartilage present between the two bones? Here hyaline cartilage. So in synchondrosis type, the hyaline cartilage is present between the two bones. In the symphysis type, the white fibrous cartilage is present between the two bones. Now the hyaline cartilage have the ossification property. The only cartilage which have the ossification property, that means they have tendency to form bones. That is our hyaline cartilage only. So over a period of time, what will happen? Now these hyaline cartilage, they are converted to bones. Now in that case, the joint is not permanent. At some point of time, this joint will disappear. So primary cartilage joint, it is a temporary joint. Why? The hyaline cartilage ossify and transfer to bones. So please write here, the hyaline cartilage will ossify and they transfer to bones. The hyaline cartilage will ossify and they transfer to bones. So these joints are temporary joints. These joints are temporary joints. Okay? Okay, sir. Now, what about the fibrous cartilage? Fibrous cartilage will never ossify. So these joints are permanent joints, present throughout a lifetime. And the secondary cartilage joint or midline joints or symphysis joints. So the secondary cartilage joints are midline joints. All the midline joints in the body are symphysis type only. All the midline joints. So the secondary cartilage joint or midline joint or symphysis joint. Now what are the joints present in the midline? This joint, symphysis menti, and then pubic symphysis. The two mandible meeting here, symphysis menti. Two pubic bone meeting here, that is symphysis pubis. Pubic symphysis. And then intervertebral joints. Intervertebral joints. Okay. And then manubriosternal joint. Manubriosternal joint. And then xiphisternal joints. And then xiphisternal joints. So all these joints are midline joints. Clear? So the midline joints are symphysis joint. Now pubic symphysis, it is an image-based question. Yes, 2 times they gave this question. 2020 FMG exam, 2021 FMG exam. Yes, they gave this question. Right? So that's all about the various types of the joints. So we discussed about synovial joint, fibrous joint, and the cartilage joint. Clear? Now next one, we're going to discuss about some basic features of the muscles. In the muscle, you have to know the arrangement of the muscle fiber, what is the shape of the muscle fiber, and example for these shapes. If you know this, that is more than sufficient for the PG entrance exam, I am saying. Okay? Right. Now, if the muscle fibers are quadrilateral arrangement of the fibers. Now, where is the quadrilateral muscle? Just remember 2 examples. Pronator quadratus muscle and another muscle which is quadrilateral shape, that is our thyrohyoid muscle. So thyrohyoid muscle and pronator quadratus, they are the quadrilateral shape. Right. Now next one, the parallel fibers and they are fusiform. Fusiform means broad in the middle and the tapering ends above and below. Example for fusiform type is digastric muscle and biceps muscle. Okay. Now again parallel fibers which are not fusiform, sartorius. Next one, the spiral or twisted fibers. Fibers will turn spirally. The fibers will twist and then attached to the bones. What are those? Pectoralis major, spiral or twisted. 2018 NEET question. Trapezius muscle, latissimus dorsi muscle. Yes, these are spiral or twisted fibers. Okay. Now next one, unipinnate, bipinnate and multipinnate. Unipinnate, the muscles are arising from only one side. Bipinnate, 2 sides. Multipinnate, many sides. Okay. Now unipinnate muscles are our flexor pollicis longus muscle arising from only one side, only one slip of origin. Extensor digitorum, unipinnate muscle. Lumbricals 1 and 2, unipinnate. Palmar interosseous, unipinnate. But remember these 4 examples. What are those? Our extensor digitorum, flexor pollicis longus, palmar interosseous, lumbricals 1 and 2. Now bipinnate, they have 2 slips of origin, muscle arising from the 2 sides. Flexor hallucis longus, rectus femoris muscle, peroneus longus muscle, dorsal interossei muscle and lumbricals 3 and 4. So rectus femoris muscle, flexor hallucis longus muscle, peroneus longus muscle, dorsal interossei muscle, lumbricals 3 and 4. Yes, they are the bipinnate muscles. Then last multipinnate muscle, more than 2 slips of origin, that is called multipinnate muscle. What are the examples for multipinnate muscle? Deltoid muscle, tibialis anterior, subscapularis muscle. These 3 examples you have to remember. Multipinnate muscle, deltoid muscle, tibialis anterior and subscapularis. These are clear? Right. So if you know these details, the general anatomy, that is more than sufficient. So we discussed the type of bones and then we discussed the type of epiphysis and then various types of joints and finally discuss the various types of muscle fibers. So these are some important topics you have to know in general anatomy for the PG entrance exam.